Welcome to Connect to Develop, where we provide insight from healthcare leaders on the hottest topic and trends. Welcome back, listeners. In today's episode, Marnie and I are joined by a special guest to explore the journey of personalized healthcare, where we've been and where it's going, and how it's transforming the way we think about patient comfort and care. Our guest is Dr. Michael Redler, a renowned orthopedic surgeon specializing in sports medicine and upper extremity surgery. He was a founding partner of the Orthopaedic and Sports Medicine Center, which later joined Connecticut Orthopaedics, where he continues his impactful work. Beyond the OR, Dr. Redler is deeply committed to opioid-sparing pain management, medical mission work, and delivering care that puts the patient first. His expertise spans clinical research, leadership and education in healthcare, and advancing treatment for sports injuries. And today, we are lucky to tap into your insight, Dr. Redler. Marnie and I are so excited for this conversation. We really appreciate you being here with us today. Thanks for being here.
That's a great introduction. And, maybe I need to hire both you as PR agents, but I'm thrilled to speak with you and I'm looking forward to a great conversation.
Yeah, likewise. As you know, I'm a big fan. When we started working back together in our previous settings, I was completely drawn to your empathetic and approach to patient care, your advocacy, Dr. Redler, the way that you really stand in the gap. I've shared with you often, many times, that if any of my children personally needed any care, that I would be picking up the phone and you would definitely be someone I would be reaching out to. So, to help kick us off and set the stage here, I would love to start with, if you could just define personalized healthcare, what does that look like from your perspective and in your day-to-day practice as a surgeon? Let's start there.
It's a great question. And it's a really good question given today's environment, because look, we know these days with decreased reimbursement, with a concentration on seeing a infinite number of patients, that personalized care becomes a challenging type thing. And to me, personalized care is no matter how much you have spent seeing so many patients, what you need to do is you need to know each individual patient. And it's a challenge because, schedules are packed, so many patients need care, but these patients are not just broken parts, they're individuals. And frankly, if you can get to the point whereby you can know the patient as an individual, not just as a broken part, take the time to know a little bit about them, you're going to deliver great care. Why? Because they know that you have that compassion, that they're not just a broken wrist, they're not just a rotator cuff tear, but they're an individual with that part. And if you can deliver that and know those type of items, you're going to give great care. And I would suggest to you, Erica and Marnie, that if you know that patient's individual, you can deliver exactly the same type of care and frankly, get better outcome just based on that one factor.
I love that. The whole not looking at the patient as one component or a broken part. You're really approaching this holistically, looking at the whole patient. And so I'd love to know, was there a moment in your career, Dr. Redler, that shifted the way you thought about patient experience or even comfort? I've heard that's been a phrase that has stuck with me, patient comfort, really changing the dialogue around how we address pain. And, you've transitioned that to patient comfort. So was there a moment that defined how you looked at that in your career? Was it always like that for you?
I think it always was. And I think that the bottom line is, if you ask yourself, why did you get into medicine? Look, if you're a bright individual, if you work hard, there are so many careers whereby you can have a terrific career and make a lot of money. And if that's your goal, God bless you. But that's not necessarily the person that should be going into medicine. And the reality is, if you care about people, if you get great satisfaction with helping someone's life, then personalized patient care is going to be second nature. And part of personalized patient care, as I said, one is knowing the patient. Two is make them comfortable. Now, comfortable means a lot of things. One, they're comfortable in the office talking to you. Two, they're comfortable with the medical decisions that you have made regarding their care. And three, If you need surgery or whatever it is, can you maximize their comfort, minimize opioid strategy and opioids use, and make them come out as a whole and not having issues with medications? All of those, frankly, are parts of being comfortable. So there's many factors to comfortable.
In a world where we see so many patients have all this access to data and a lot of them just want a quick fix or that magic pill, so how do you walk them through that opioid minimizing strategy?
Well, great question. And I think in 2025, patients' awareness about the opioid issues are much greater. Books like Empire of Pain have told us much about the whole journey that we have come through with the opioid sparing strategy. Nevertheless, patients sometimes are looking for the instant fix. And what you need to do is say, look, we're going to develop a game plan together. And the game plan together is, here's your issue, here's our alternatives, here's how we can treat you, and here's the possible outcomes. All of those are going to be discussed. They're going to be discussed how we're going to get you better without causing secondary problems like addiction to opioids.
Dr. Redler, just hearing you, and because I know you as well, I know that your passion and compassion for patients, it runs deep. And so was there a particular clinical, story with a patient, a family member, a friend that deeply impacted you? Because again, you're a voice of advocacy in this space in a very, very loud and impactful one. So was there something that influenced that for you?
I think intuitively early on, I knew in my mind that using a lot of opioid pain medication to treat patients was wrong. It wasn't popular because, frankly, the bottom line is that we were taught years ago, and part of that was driven by the pharma industry, Purdue Pharmaceutical, et cetera, is that pain was the fifth vital sign. But somehow we knew that was wrong. And we knew it was wrong because we saw all the horrible side effects from it: the nausea, the vomiting, the constipation, the readmission. And the worst yet is the addiction. And even worse than that, overdose and death. And so early on, if I would have those discussions with patients, it wasn't always popular. And what I used to tell patients years ago, and this is before any of the big strategies that are present now, is good, well-meaning people get addicted to narcotics. It's not just some bum in the street. And if you're talking to some highly successful businessman with a great family, they think it doesn't apply to them, but indeed it does. And I would tell patients back then, and this is going back many, many years ago, if I don't have this discussion with you, I'm doing you a disservice. And it resonated with more and more people. We looked at strategies. We learned more about how to handle discomfort. And I use the word discomfort, not pain. And then we got allies. We got allies in other physicians. We got allies in companies that were making non-opioid strategies for maximizing comfort. And so it became more popular. But, frankly, early on, I was clearly a salmon swimming upstream.
What do those conversations look like today?
Yeah, and that's a great question because, look, in today's day and age, and it's multifactorial, there is much greater awareness now of the opioid epidemic. And people think, okay, we've addressed it. We haven't addressed it. We've started. We have not finished. And what I will tell you that the most important thing I think that I do is patient education. Every single one of my patients who's going to have surgery has the same discussion 3 different times. When we're in the office and we're discussing, say they're going to have a rotator cuff repair, we talk about the surgery, we talk about the post-op period, we talk about how we're going to minimize discomfort by using a multimodal approach. I go over it with them in great detail. When they're in the pre-op area before surgery, we have the same conversation again. And then in the post-operative area, and hopefully with another family member, we have the same conversation again. And by that time, they have all heard it multiple times. They get it. They're on board. We talk about the fact this, the good news is this strategy works great. We become enthusiastic. We become the cheerleader. And you know what? They're on board. And it makes a huge difference.
Absolutely understandable. So, can we talk about how patient care has evolved? So, to the point of salmon swimming upstream, love that analogy. Grew up with avid fly fishing grandparents and parents. What was the norm when you started practicing? I mean, you say that it was just to kind of, throw some medication at it. And then in terms of this, comfort and personalization, was that something that just slowly changed with more patient awareness or more other providers and peers? How did that genesis go?
Early on, I think my discussions were unpopular because, frankly, you said, you're not going to give me 60 Percocet. You really don't care about my pain. And so it became a bigger challenge to say, no, I care about you and I care about making you comfortable. And look, I think early on there, maybe patients went elsewhere if they weren't hearing what they wanted to hear. But I think that what happened is that over time, we found a few like-minded physicians. And one of my early connections was Scott Sigmund, who's a very good friend, another great opioid-sparing surgeon who I met early on. And I said, wow, we have the same thought pattern. And then all of a sudden, a few others joined on. Paul Sethi joined on. And all of a sudden, there was a small band. It was now a stream of salmon swimming upstream. And we put white papers together. We discussed it. We gave lectures. And early on, it was not heard. And then as it became more apparent what some of the big pharma industry was doing and the opioid crisis and the PR that was occurring to encourage more opioid use, it gained momentum. And at first, we felt like salmon swimming upstream. Then we felt like a small army of brothers and sisters fighting the crisis. And all of a sudden, we had this big army. There was this wave of enthusiasm. And we've come a long way. But again, I want to emphasize, Marnie and Erica, we are not done. We are on the pathway, but this is not a done deal. And we need to keep preaching and we need to keep discussing it and we need to keep educating.
Education is so critical, and I can hear the urgency around the education piece and the advocacy. So when you think about just our landscape of healthcare and how rushed, how things are moving so quickly, we're focused on really kind of what feels like getting patients in and out, right? Like I've been that patient where I go in, I'm having either whether it's a treatment or just a follow-up, and I just feel like I'm a number in line and I haven't really gotten that great care in a long time. So in a system that feels so rushed, how do you personally create space and set the example for colleagues around empathy and individualized care, since it is becoming more of a, I guess, patient demand at the same time? They're becoming more educated. So just curious to know, like with our rush system, how do you create space for that?
I think that part of healthcare is a bigger challenge than ever. And part of the reason for that is that, look, we see Medicare cuts, there's decreased reimbursement, there's increased things that are included within the global period. And frankly, you've got a bunch of big healthcare systems, you've got a bunch of big groups, and in order to cover overhead, in order to theoretically make a good living, you're supposed to be seeing more and more patients. And look, if you do a good job, a lot of patients want to see you. But here's my thought pattern on that. Patients sometimes have waited a long time to get an appointment. Frankly, they sometimes will wait in the waiting room, because what I always feel like I need to practice is when I'm in the exam room with a patient, and even if there's 10 patients in the waiting room, they need to be the only individual. And I need to know about them. I need to know about what their problem is. I need to know about the rest of their life. And what I hope, and I think is the case, is that even though they may have waited for an appointment and they have waited in the waiting room, they walk out of there knowing that I know them as an individual. And practicing factory medicine is never going to be something that's going to be appetizing to me. It's a challenge, because the bottom line is that for a lot of healthcare systems and major groups, You may just be an Excel spreadsheet, but you know what? You're the difference maker in that individual's lives, and that always has to come first.
I love that. So in this world of throughput and RVU or collections based or even, bundled payments, for the younger physicians out there building on their practice, trying to get busy, trying to build that word of mouth, how would you recommend to them that they go about building that trust and their personal care methodology?
I think what you have to do is look at yourself in the mirror. Why did you get into medicine in the first place? And again, look, you want to support your family, you want to make a good make be able to make care of your bills and whatever else you need to do. But I think that if you put at the very top of the pyramid, patient care and patient outcome, everything else works out for themselves. And look, you can be one of those guys that's in and out in 3 minutes and do huge volume and, show what your billables are and your collections are. But if there's that satisfaction with affecting patient lives, that pays a lot of dividends as well. And it's a careful balance. It's not easy. And I don't know that it's a perfect system in today's world. And if, frankly, if cuts continue with Medicare, et cetera, it may become more and more challenging. And it becomes even more important to have the right set of priorities when you're seeing patients.
Where do you see the future of personalized healthcare going, given all the dynamics at play, specifically when it comes to patient comfort, compassion, care delivery, and so on?
Yeah, it's a challenge because there's only so many hours in the day. There's decreasing reimbursement. The primary care physicians have gone more to a concierge model. There may ultimately be something like that for orthopedic surgery as well. I mean, we'll see. And for other specialties, a complicated balance sheet, and it's one whereby I think it's ever evolving. What you hope is that there's a premium patient care and outcome that's going to allow you to even the playing field, but it's not easy. And I don't think it's getting easier. So I think for young physicians, finding that balance is really important. But just remember, patient outcome and patient well-being is still got to be the number one priority. And that has to be just talked about over and over again.
I couldn't agree more. And thank you for that. Can you tell us how being a surgeon has, in just all your experiences between all that you do in mission work, day to day with patients, day to day with your colleagues, how has this shaped you personally, just beyond your role as a surgeon?
Yeah, it's been an interesting life and it continues to be an interesting career. And I think, what I will tell my colleagues is, look, I grew up with somewhat more meager beginnings. We moved around a lot as kids. By the time I got to sixth grade, it was my 6 different elementary school. I was always the new kid. We had one family car. College was all loans. Medical school was all loans. And I chose the least expensive medical school because I was paying for it. But the reality is now, all these years later, it's provided me a great livelihood. And I think that what better thing can I do to say thank you for that livelihood than to give back to those most in need? And that was what has driven me to medical mission work. And frankly, taking care of people that just want a chance to get better and take care of their family and have no means to do so. And will just say to you, God bless you, God bless you. Might please take a picture with you is my greatest sense of satisfaction. And when I tell my colleagues who I've had come on missions with me, I think that's what we're supposed to do.
Absolutely agree on that one. If you could stand back and design the ideal patient experience, soup to nuts, what would that look like for the patient?
An ideal soup to nuts experience would be being able to be informed enough to know where you should go for your care, to have a great experience from the person who answers the phone to make your appointment, to a friendly, caring face when you check in, to having seamless exchange of insurance information, to feeling like an individual when you get into the office and feel like you've been heard. When I have students with me now, what I'll say to them, look, you're going to see some patients during the course of our day that you can say, oh my gosh, I don't even know why they thought they needed to come in to see this. This is not a big deal. But you have to remember, as the provider, as the person taking care of them, to them it's a big deal. They've gone through making the appointment, waiting for the appointment, going through the waiting room, giving all that information. So them is the most important interaction. And as long as you understand that and you know that's the important interaction for them, and maybe it's just resting their fears, maybe it's just reassurance, but there's great value in that as well. And if you remember that when they come in, to them, it's a really big deal, everybody's going to come out ahead.
Yeah, it's so true. It's their perception. It really is their reality. And you touched on this a little bit earlier when you mentioned, if you've got 10 patients in a room, you want that patient to feel like they're the only patient. And as we get ready to wrap up here, I want to hear a little bit about what is that one thing that you hope that every single patient that interacts with you walks away feeling after having had any interaction with you. I'm actually going to make this two-part. I just thought of this. One from the patient perspective, but then the other from your colleagues and those that are young surgeons.
So I think that whenever you see a patient, what they want to get out of the visit is, one, they weren't just a broken part. They're an individual. Two, they want to walk out of their visit thinking, oh my gosh, that's someone I could have been friends with because they listened to me, they made eye contact, they understood my problem, and they laid out a game plan. And I think that these are just interpersonal skills are so important. When I have students, Erica and Marnie, one of the things I tell them is that listen to what the patient has to say. They're going to a lot of times tell you what's going on. Two, observe what the patient's not telling you. And that's the whole concept of nonverbal communication. Are they seeming fidgety? Are they looking uncomfortable? Do they look like they're getting lightheaded? Are they looking at their watch because they've been waiting for a long time? And whatever it is, part of your art and skill as a physician is listen to what they have to say, and then what they're not saying, verbalize for them what they're not communicating. Verbalize their non-communication, because that's going to go on to be a winning solution for them every single time. And if you say, hey, you seem really uncomfortable with this idea, or the idea of doing therapy or of doing surgery seems really uncomfortable to you, then they know that you've heard them. You not only heard them, but you've seen them. And if you can connect with the patient on that level, communicating with them and then verbalizing their non-verbal body signs or communication, you're going to win. And what I would say to younger physicians, anyone, if you can have that level of communication, not only are you going to get great outcomes, you're going to have great patient satisfaction, you're going to achieve the mission of taking great care of your patients.
There are so many nuggets and pearls in everything you just said, Dr. Redler. We're so grateful that you were able to be with us today and just share some of your experience and just your perspective on patient comfort and patient care and where we're going. We really appreciate you joining us today. It's been a complete pleasure. I enjoy every interaction I have with you, as you know. Thank you for being with us today.
Erica, I think you're a very special individual. Marnie, you're absolutely terrific. Look, I'm so proud of what you're doing with this podcast. Thank you so much for having me as a guest. Just spending a few moments talking about some of my passions has been terrific. And I know you guys are just going to hit a home run as you move forward with this outstanding podcast. Thanks so much for having me.
If you want to learn more about Dr. Redler, please check out his bio in the show notes.
You can find more interviews on our YouTube channel at Marnie Reed Presents.